Ever pondered the method by which physicians gauge the extent of jaundice in a patient's bloodstream? Well, it's all about measuring the concentration of a yellow pigment named bilirubin, which is a byproduct of the normal breakdown of red blood cells. The tool that makes this possible is a clever device known as a bilirubinometer, or more colloquially, a jaundice meter. So, what's the science behind this intriguing instrument? The bilirubinometer operates on the principle that bilirubin absorbs light, particularly in the blue-green spectrum. The device emits light, typically within a wavelength range of 450 to 500 nanometers. This light is directed through the patient's skin, and the bilirubin within absorbs some of it. The amount of absorbed light is then measured by a photodetector, and this data is utilized to calculate the bilirubin concentration in the bloodstream. Now, how do you go about using a bilirubinometer? First off, the patient needs to be prepared. This involves ensuring that the skin is exposed, clean and dry. Once the patient is ready, it's time to set up the device. You power it on, let it warm up if necessary, and calibrate it according to the manufacturer's instructions. After this, the measurement process can begin. The device probe is placed on the patient's skin, usually on the forehead or sternum. It's vital to adhere to the specific guidelines for proper contact and positioning. When everything is set, the measurement is activated and the device emits light and measures the absorption. When the measurement process concludes, the bilirubinometer provides a numerical value. This figure represents the concentration of bilirubin in the patient's blood. Healthcare professionals then compare this value to reference ranges to assess the severity of jaundice. This information helps them determine whether further medical intervention is necessary. A few things to bear in mind about bilirubinometers. Firstly, always follow the manufacturer's instructions for calibration and usage. Secondly, these devices are commonly used in neonatal care to monitor jaundice in newborns. Thirdly, in situations where accuracy is vital, lab blood tests may still be performed for confirmation. Lastly, always consult with healthcare professionals for proper use and interpretation of bilirubinometer readings. After all, these results must be considered in the context of the patient's overall health and medical history. So, there you have it. The bilirubinometer, a fascinating fusion of science and medicine, is an invaluable tool in the diagnosis and monitoring of jaundice. It's a testament to the incredible advances that continue to revolutionize healthcare and improve patient outcomes.